My dad was an orthopedic surgeon, and I kind of liked the way he was recognized in the town where I grew up. He could go to a restaurant, and a waiter would approach and say, "Hey, Dr. Castro, I need to see you." And he would give, you can come, this is my card, call, I'll see you soon. When it was time for me to pick, GI was kind of a nice fit. It allows you to do procedures at the same time you are like a medical doctor. So it has a lot of both sides. First time visit is more about knowing each other, getting to know your history. When I come into the office, I like to give the patient some time to tell me what exactly is in their minds. All right, what is the main problem? Because you might have multiple medical problems, and I really like to know what is that piece of information that is more important. At the very end, I go step by step what we kind of what the plan is. If I advise my patient to have some kind of procedure that she or he are not familiar with, I like to give them that information about, so let's say that you're going to have a colonoscopy, never had a colonoscopy before. I try to put in my own experience with my colonoscopy, what I did, how it went. In that way, you kind of, that anxiety of the unknown is kind of, out of the picture. Putting it in very simple terms, in that way they kind of can pass the page. And if you don't do that, they go home and they feel like, not everything was addressed. Even if it is not relevant, at least explain why, And that's the way I approach it. My last patient today is a 99-year-old. It becomes almost like family. I have to hold sometimes my tears because it actually gets to me. A big part of it is having the opportunity to help people and make a big impact in their lives.